Frontline healthcare workers are the true heroes in this pandemic, putting their lives on the line every day. WRAL's Cullen Browder now with the toll it's taking and how hospitals are trying to help.
Job-related burnout in healthcare is estimated to be 50 to 70%. Doctors and nurses at places like WakeMed and many other hospitals are used to providing care, but at this time, many of them need care, both physical and mental. Studies estimate 15 to 20% of frontline healthcare workers already meet criteria for post-traumatic stress disorder. Now add in the fight against coronavirus.
It's almost like a wartime situation.
Dr. Clark Gaither, Medical Director for the North Carolina Professionals Health Program, recently wrote about the impact of work overload, a lack of control over whether there will be enough personal protective equipment, and the detachment from colleagues and family.
If their symptoms of burnout are increasing, it can leave them bitter and angry and resentful.
It's very traumatic. What is different about this trauma is that it's not a trauma that has a clear end.
Dr. Nadia Shargia, Medical Director of UNC Psychiatry Outpatient Services, leads efforts to provide her own team with counseling to cope with not only stress, but isolation.
Providers that typically work in teams together are separated from one another. A lot of those points of contact, points of connection that allow us to just automatically de-stress at times without even thinking are not available to us any longer.
She's dealing with professionals good at helping, but not always good at asking for help.
And how to help everyone just be able to kind of accept that right now. We're not looking for perfection. We're all in this state of chaos and turmoil.
Doctors and nurses are rising to meet that chaos and turmoil now. But what about the long-term impacts?
Once the pressure is let down, once it's relieved, and we go back to some sort of normalcy, that's when the full impact of what has happened may weigh down on them. So we worry about things like increased depression, increased thoughts of suicide.
Hospitals are trying to keep an eye on the stress and fears of their staff. Time off usually helps in the healing process, but in a time like this, vacation time is not always an option. Cullen Browder, WRAL News, Raleigh.